Well, our topic here on concierge and direct primary care, I guess just to emphasize, we see the growth as a symptom of the growing deterioration, I would say, or maybe just the complexity of getting the care you need within the formal system. Finding
Hmm.
your primary care where you can only pay for it through insurance, primary care providers that need to operate through insurance so that they can take care of their patients. So it's the opting out of that system as it grows. It's a suggestion that that system isn't working for the people it needs to work for.
Hey everyone, this is Jonathan Marx from GoToHealth. I hope you're having a great day. We've got an important topic for you today. Fee-based primary care is rapidly rising in the United States, hastening doctor shortages for the public. Researchers report a growth in corporate-owned fee-based healthcare practices that are not accessible to everyone. The number of concierge and direct primary care practices are rapidly rising across the U.S., highlighting a fundamental shift in how Americans are receiving primary medical care, a new study finds. Between 2018 and 2023, 5 years, the number of concierge and direct primary care practices nationwide surged by 83%, and the number of clinicians working in them increased by 78%. These findings are published online in the December issue of Health Affairs. If you want to read about this study, you can learn more by visiting bit.ly, that's bit.ly/fee-based care. This rapid growth is fueled by primary care clinicians who are moving away from traditional settings where healthcare workers often experience challenging workloads and increased chances of burnout. Clinicians report that these new models offer smaller patient loads and less administrative burden associated with insurance paperwork, which can lead to improved job satisfaction. Patients who can afford these kinds of services also are more satisfied because they get more focused care from their doctor. Our guest today is one of the authors of this paper, Dan Polsky, PhD. He's the Bloomberg Distinguished Professor of Health Economics at Johns Hopkins University. He's a national leader in the field of health policy and economics and has dedicated his career to exploring how healthcare is organized, managed, financed, and delivered, especially for low-income people. Before we get to Dr. Polsky, we encourage you to visit our website and subscribe at gotohealthmedia.com so you learn more about our shows. And if you like our shows, please give us a thumbs up or a 5-star review on YouTube, Apple, or Spotify so that more people can learn about our work. Thanks for helping us in advance. So welcome to the show, Dr. Dan Polsky. How are you today?
I'm well. Thank you for having me.
Good, it's a pleasure. So please explain to us, there are two terms and I want to understand the difference. There's direct primary care practice and concierge doctor practice. Is there a difference between those two, and what is the difference?
Yeah, so that's a great question. There's a slight difference. So concierge practices are a type of primary care practice, but they charge a patient an annual membership or retainer fee to get like greater access. So the doctors would have smaller panels and they get, some type of, premium care,
Mm-hmm.
longer visits, same day appointments, things like that. They can maybe get the cell phone of the physician. The difference between the concierge and the direct primary care is concierge practices often still allow for billing of services for office visits and procedures.
Mm-hmm.
Direct primary care, it's similar. You get this kind of enhanced care,
Yes.
but you don't bill insurance at all. Patients pay a monthly and an annual fee that covers like a defined set of services. So it might include things that you wouldn't get in concierge practices that are included under that direct fee, like lab services or more clinical services
Mm-hmm.
might be under that model that might not be under concierge practice for the fee that you supply. But you also get consultative care coordination, comprehensive care management, things like that. So the big difference is direct primary care is somewhat separate from insurance. So then you might also have to get like a high deductible health plan or something like that to go along with it.
Yes.
Concierge practice, which is often more money than direct primary care, like an annual fee. So you really kind of subscribe to greater access.
Mm-hmm. And when does insurance kick in? I mean, do insurance plans kick in with these two kinds of practices for other services that are needed, like hospitalization or drugs?
Yeah, I think that's really important. So it's primary care. So, something could go wrong and you need to have a go to the hospital, have surgery, see a specialist.
Hmm.
All that would be under insurance.
Okay, good. So
Um,
you're not giving that up. It's you're
you're
paying for
not
this
giving that
direct
up.
care plus you're paying for your insurance, whatever cost that is.
Yeah, and if I mean, you could opt out of insurance and just do, say, direct primary care, but then if something went wrong,
Yeah, right.
you'd be on your own.
Got it. So what's fueling the growth in these two kinds of primary care practices?
Yeah, so what motivated us for the paper that we wrote that I think has led us to have this conversation is that traditional primary care is in crisis. So many people, in this audience may have had some challenges identifying primary care provider, find their primary care provider doesn't have a lot of time on their hands to spend an adequate time with their concerns. And the clinicians themselves are burning out. The pressures on primary care in the formal primary care system are enormous. In that picture I've painted, there's both a supply factor and a demand factor. So the supply factor is that physicians are looking for a better way to spend their time than spending 15 minutes with each patient and just trying to make the revenue model work. And traditional primary care is funded through insurance. And there's an opportunity to have fewer patients, to have a more rational, to do the type of care that they did their training for, to spend more time with patients, understand their problems under these alternative models that we discussed. So that's one element of the growth, but you also see that on the patient side. Patients, particularly patients who have some income, disposable income, want more time with their doctors,
Yes.
are dissatisfied with the type of care they're getting, where the only way they can get that care is paid through insurance, which might have a limited duration of a visit. So they're looking for alternatives, and they find that concierge or direct primary care practice model to be quite attractive.
So how quickly is this whole area growing? I mean, do we have a sense for numbers?
Yeah, it's great. So we set out to measure that. So there's a lot of anecdotal evidence that there's some growth. And so what we found is between 2018 and 2023, so that 5 year period
Hmm.
that we measured, that the number of concierge and direct primary care practices, we kind of combine the two,
Hmm.
have grown by 83% over that period.
Wow.
The number of clinicians have grown by almost the same amount, 78%. So we believe that this is not just the niche trend, but the growth is really something that requires some sustained interest and attention for, the entire system.
So I suppose that physicians, perhaps individually, have figured out how to make this work financially. They've figured out a financial model for themselves, correct?
Yeah, so it's still mostly in neighborhoods where patients are a little better off and can make the payment. But yeah, so if you, chop your panel size, so the
Hmm.
number of patients you're responsible for in your primary care practice, let's say you cut it from 2,000 to 500,
Yep.
your revenue better go up by at least four times that.
Right.
And some of these fees that are part of, joining concierge medicine, it could be, a few thousand, $10,000, that annual level of access. So
Hmm.
if you multiply that by a 500 patient practice, that can, sustain pretty comfortable living. But the key is it's not cheap, and it's extra spending outside of insurance. So it really only lends itself to a patient population that has the means to have this extra access.
Now, I would guess if it's growing this quickly and it continues to go to, I would guess that there are corporations that are going to figure out how do I get into this business and it will become more corporate. Is there a trend toward that or do we see that coming in the future?
Yeah, so we looked at that too in our paper. The traditional view of concierge practices is somewhat a boutique practice. You kind of go off on your own, you start your own business, you have this
Right.
independent ownership, and you're have total freedom, kind of the entrepreneurial spirit. But the number of independent ownership practices have declined from about 84% of the market to 60% during this 5 years that we examined this.
Hmm.
And so the growth decline in independent ownership was made up by a growth in corporate affiliated practices.
Hmm.
So from that low base, it's growing by like 5x over this 5-year period. So that's the growing trend, and it's probably due to there's an opportunity to make some money by formalizing these practices, trying to build out scale given this anticipated demand. So you can imagine under a corporate affiliated practice there and broader scale, there may be an opportunity to like lower fees and lower entry. And it's an advantage to some of these physicians that have gone off on their own.
Mm-hmm.
And if you're under a concierge model, you still have to do the billing. And the billing can be somewhat of a hassle, and the corporate ownership could take that over. But our concern about the growth in corporate ownership is that move towards that meeting the shareholder needs. It could change incentives around pricing and the service intensity. You might get less time with the doctors under, if there was no ownership. So it could really lead the doctors into some of the same models that they wanted to leave in the first place.
I was just going to suggest that. I was just going to suggest that if you get corporate ownership, they're going to want more profitability. So let's get back down to the 15-minute visit. I would, that's a perfectly reasonable thing to expect if with corporate involvement in this.
Yeah. So, go full circle. That's, I think, something we need to keep an eye on.
Good. So the doctor has mentioned his paper, and let me tell you where you can go to read more about that. I've made a special link for that. If you go to bit.ly, bit.ly/fee-based care, bit.ly/fee-based care, and that will take you to the paper that the doctor and his compatriots have written about this issue. So, doctor, let me ask, with the incredible growth that we're seeing in direct primary care and concierge care, where does this leave the rest of us who can't afford this kind of service? Is that going to create more of a doctor shortage and exacerbate this problem?
Yeah, I mean, that's definitely a legitimate concern. And one of the things that we looked at was where the doctors are coming from that are entering, concierge medicine. And it's a wide range of traditional settings. So, we think of it as a substitution. So there's already a, crisis in, traditional primary care, and hard to find the primary care provider if you're looking for one. Our evidence suggests that this could exacerbate the challenges of finding a primary care provider if you're trying to find it through insurance.
Mm-hmm.
But the other important point that you make for the rest of us is that we can't afford to find a doctor that is going to have a panel size 1/4 the size of our current doctor and do it on our own without insurance, or have it supplemented by insurance by paying $10,000. So we're then trying to find adequate primary care within a kind of a shrinking supply. But that's our concern. There are some mitigating factors to think about. Those that are leaving traditional primary care might have left entirely.
Mm-hmm.
We're not able to look at that. So it could help retain clinicians.
Mm-hmm.
And possibly there are new doctors that are motivated to go into primary care because they want to join the concierge model. So there could be an argument that the entire supply might end up growing, but I think in the short term, it's likely to exacerbate, our need to find more primary care providers in traditional insurance.
Let me ask too, there's a crisis in rural healthcare. Hospitals are closing, patients have to travel longer distances to see doctors. Does this whole move towards concierge doctors and direct primary care, does that exacerbate again the problem in rural healthcare?
It's unlikely that the concierge practices are going to be locating in rural markets.
Mm-hmm.
The ability for rural healthcare to attract clinicians that are so needed, I imagine that's on the margin. This certainly is not. I would say that there's a huge crisis in rural healthcare. The trends around concierge medicine probably are not in that market.
So with all these issues and trends, what do policymakers at the state and federal level need to understand and do to protect healthcare access?
Yeah, that's a great question. Well, one thing is we need better data. How are these models? We should be finding better ways to track it. If it's somewhat off of insurance, there's no formal way to track what's going on, but I think we have to keep an eye on what happens outside of the formal system, or we'll be blindsided. So hopefully our our work is starting to shed some light on that, but more data is needed. But we also need to know more accountability for quality of care under these models. Since they're a little bit off the grid and not responsible to insurance, they may be engaging in care that might overtreat their patients and not really be accountable to the type of evidence-based care that you might see in more formal systems. So, we should be tracking access and quality. We need clear rules for consumer protections, especially, these models sit off the grid. So those are some of the things I think would be most important. And then just, an ongoing attention to the supply of physicians and the worsening primary care shortages.
Got it. So, Dr. Polsky, you have focused for many years on research in healthcare for low-income patients. What drives your interest in this field?
Yeah, and really I'm interested in the relationship between health insurance and healthcare providers. I think it's kind of a double-edged sword in that if you have health insurance, you have more access to care than if you don't have health insurance, especially if you're in low income. So I guess it's the poignancy of this relationship for low income populations. They're totally dependent on insurance to find access to providers. But the challenge is the double-edged sword of insurance. On the one hand, it provides greater access because of the financial protection, but you have to work through insurance to find the providers you need.
Mm-hmm.
And that is incredibly challenging. And if if you have health insurance, like through Medicaid, for example, if you don't find a provider that's contracted with your Medicaid program, you're completely on the hook, or that doctor's not going to see you at all. So the safety net is not there unless you figure out how to work well with insurance. So yeah, so the interest in low-income populations, just their vulnerability to our crazy healthcare system is extreme. And I think the type of work I do will hopefully try to make it easier for populations that are most at risk for the challenges navigating our healthcare system.
Is there any question that I haven't asked that I should have asked, Doctor, or is there a last message you'd like to leave with people today?
Well, our topic here on concierge and direct primary care, I guess just to emphasize, we see the growth as a symptom of the growing deterioration, I would say, or maybe just the complexity of getting the care you need within the formal system, finding your primary care where you can only pay for it through insurance, primary care providers that need to operate through insurance so that they can take care of their patients. So it's the opting out of that system. As it grows, it's a suggestion that that system isn't working for the people it needs to work for.
Do you have recommendations, or is somebody at Johns Hopkins doing research on how we fix this medical care system? Should we be going to like a Canadian system or a Scandinavian system where it's really a national healthcare system where everybody gets health coverage?
Yeah, I mean, there's some great work going on at Johns Hopkins in our center here, the Hopkins Business of Health Initiative. But we're working in so many different areas, and I think my lesson from the work that we're doing and the work I see from great researchers around the country is that there really is no simple solution. There's no, boy, if we just tried this, everything would work. If we got rid of insurance, if we had direct primary care, we have a very complex healthcare system, and one solution is not going to fix it. But I think this view that we need better access, we need greater affordability, we need to provide healthcare that is of high value and high quality is something that we need to work together for. And I think at the end of the day, the greatest challenge to making changes is that somehow we believe that healthcare is free because we get it through insurance. We don't really see how much we pay for our health insurance if our employer pays for it. Right. So healthcare is like 18% of our national income, yet people think they need to get it for free. Mm-hmm. So the decisions are really difficult if we're going to solve this problem, because someone's going to have to say no for care that people want.
Got it.
And there's no one that really wants to do that.
Right. Especially in the political area. Yes.
Yeah.
Who wants to say no? Again, if you want to learn more about the doctor's work, you can go to the link I created. It's bit.ly/fee-based care. bit.ly/fee-based care. Dr. Polsky, thanks so much for being with us today. It's been really, you've really outlined the difficulties that we're having with our healthcare system and the trends, and I really appreciate the work that you're doing.
Well, thanks so much for inviting me, and I really enjoyed our conversation today.
Good, me too. We've been talking with Daniel Polsky, PhD. He's the Bloomberg Distinguished Professor of Health Economics at Johns Hopkins University. He's a national leader in the field of health policy and economics and has dedicated his career to exploring how healthcare is organized, managed, financed, and delivered, especially for low-income people. His own research has advanced our understanding of the cost and quality trade-off of interventions, whether they are changes to large federal programs or local programs. Again, thanks so much for being with us today, Doctor. It's been very informative.
All right, have a wonderful afternoon.
Good. This has been Jonathan Marks with GoToHealth. Remember, visit our website at gotohealthmedia.com. You can subscribe so you can see more of our shows. And we thank you for being here. This has been Jonathan Marks with GoToHealth. And as we say at the end of every show, go to health. Take care. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.